Hello everyone, my name is Hannah Holtz, BSN RN, and I'm here to speak with you today about deep vein thrombus, or DVT. The reason I'm speaking with you about this today is DVTs are the primary source for PEs, or pulmonary embolisms, and PEs can be fatal. So understanding how a DVT is formed and how to prevent it will hopefully lower our risk of having a PE. So first we'll talk about how a DVT is formed, or the pathophysiology behind it. So a DVT is formed where there's hemostasis or clot formation at the site of the vessel wall injury. So where that vessel wall got injured, the smooth muscles will contract. And that smooth muscle contracting will slow the blood flow in that area. And the slowing of the blood flow will signal activation of the platelets. And these platelets have chemical mediators on them. And these mediators signal for thrombin and other clotting factors to begin that clotting cascade, thus forming the clot. There are two main causes behind the DVTs. The first is a roughened endothelial surface to the vessel, and this can be caused by arteriosclerosis, infection, or trauma. The second is blood clot, where it's very slow moving through a vessel that has procoagulants or thrombin being formed. And 90% of DVTs occur in the deep veins in your legs. So next we'll talk about some predisposing factors or risk factors for developing a DVT. So these include congestive heart failure, prolonged immobilization, especially after a major surgery, infection or sepsis, hypercoagulability. An example of a hypercoagulability is pregnancy, obesity, smoking, diabetics, and a history of DVT or varicose veins. Some signs and symptoms of a DVT include the following: swelling, erythema, heat, tenderness, a positive Homan sign, and pain with ambulation. Some subjective data that patients might say is, my leg feels hot and heavy, it hurts when I walk. Additionally, that affected extremity will feel cool to the touch and will have decreased peripheral pulses. So how do you diagnose the DVT? There's some lab studies that can be done. These include bleeding and clotting times, as well as a prothrombin with an INR and a D-dimer. Some imaging studies that can be done include a venous ultrasonography with vein compression and Doppler flow analysis. So once you have your diagnosis of DVT, how do you treat it? One way to treat it is with TPA. TPA can be administered directly through a catheter into the area with the thrombus. So this TPA activates plasminogen, endoplasmin, and can dissolve the intravascular clot right at the site. IV heparin can also be utilized. IV heparin, once started, can increase your blood clotting time from about a normal 6 minutes to 30 minutes and can prevent or slow the development of your clot almost immediately. Additionally, warfarin can be given PO. Warfarin inactivates prothrombin factors 7, 9, and 10. So while these factors are still being made, they will have a decreased coagulant activity. And most importantly, how do you prevent a DVT? So patients can wear compression stockings. In the hospital, they can have SCDs put on. Lifestyle changes can be made, such as losing weight, staying active, early ambulation after surgery, and on long-distance travel trips, stopping every couple hours to get out and walk around and have that movement. Thank you, and I appreciate your time.